Hello guys, welcome to my channel. My name is Abdrazak, fourth year medical student, and in today's video we shall be looking at prokinetic drugs. So what are prokinetic drugs? So these are substances which enhance transit or movement of materials through the GI tract. So these substances, in simple terms, they increase or enhance movement of materials throughout our gastrointestinal tract. So they increase neuromuscular transmission. So these drugs are used for one, gastroesophageal reflux disease (GERD). Secondly, we can use them in gastroparesis. We can use them in nighttime heartburn. Fourth, we can use them in severe refractory constipation. And lastly, they can also be used in emesis or vomiting. In our next slide, it is trying to show us the first class of the prokinetic drugs. Of course, one being the serotonin receptor antagonists. So these exert their potent antiemetic properties via the blockade of the 5-HT3 receptors in the 1 peripheral in the GIT, secondly in the vomiting center, and in the chemoreceptor trigger zone. What we should know about them is that they are only effective in emesis attributable to vagal stimulation, e.g. postoperative and chemotherapy. Another thing we should know about them is that motion sickness is poorly controlled here, so we don't expect to use them in case someone has a motion sickness. So there are 4 agents here. There is ondansetron, granisetron, dolasetron, and palonosetron. Those are the main categories here. What we should know about them is they undergo extensive hepatic metabolism and are eliminated mainly via the renal and the hepatic route, and dose reduction is not required in patients with renal impairment, so we can still use them in case someone has renal issues. Dose reduction is required for patients with hepatic insufficiency for ondansetron. So if a person is using ondansetron, we need a dose requirement in case the patient has a hepatic insufficiency. What are the clinical uses of the serotonin receptor antagonists? 1, they can be used in chemoreceptor induced nausea and vomiting. Secondly, they can be used in postoperative and post-radiation nausea and vomiting. And their efficacy is enhanced by combination therapy with corticosteroids like dexamethasone and Neurokinin 1 receptor antagonists. An example is apriptant. The most common adverse effects are headache, nausea, and constipation. The second category of the prokinetic drugs are the corticosteroids. The main examples being the dexamethasone and methyl prednisolone. So these agents enhance the efficacy of 5-HT3 receptor antagonists for prevention of acute and delayed nausea and vomiting in patients receiving moderately to highly emetogenic receptor emetogenic chemotherapy regimens. Most cases we use dexamethasone 8 to 20 milligrams intravenously before chemotherapy, then followed by 8 milligrams orally for 2 to 4 days. So they are not used singly to manage vomiting because we have seen they only enhance the efficacy of the 5-HT3 receptor antagonists. Another class of the prokinetic drugs are the anticholinergics. The most common example being hyoscine or scopolamine. These act via blockade of M1 receptors in the vestibular apparatus. So they are used mainly in motion sickness and vomiting caused by irritants in the GIT. An NB here, hyoscine is employed principally for prophylaxis and treatment of motion sickness, and is often administered as a transdermal patch because, of course, it is of a high incidence of anticholinergic effects when given orally or parentally. The major side effects here are dizziness, sedation, confusion, dry mouth, cycloplegia, and urinary retention. Another category of prokinetic drugs are the antihistamines. So these act via blockade of H1 receptors in the vomiting center and vestibular apparatus. The uses, one of the examples is meclizine, which is used mainly in motion sickness and the treatment of vertigo due to labyrinth dysfunction. Another agent here is promethazine, which is mainly used in pregnancy-induced vomiting. There is also diphenhydramine, which is used in conjunction with other antiemetics for treatment of vomiting due to chemotherapy. Another prokinetic drug is metoclopramide. It can also be called Reglan. It is an antiemetic and improves gastric emptying, so it indirectly reduces acetylcholine. Its major mode of action is blockade of D2 receptors in the GIT and blocks the normal inhibitory effects of dopamine, resulting into increased GIT motility. The major actions are dopamine D2 receptor antagonist. Then it can also act as an agonist on 5-HT4. So it can be used to control vomiting due to uremia, radiation, chemotherapy, and other conditions. Its pharmacokinetics, it is rapidly absorbed from the GIT but undergoes extensive fast metabolism. It is capable of crossing the blood-brain barrier, metabolized in the kidney, and excreted in urine and breast milk. The adverse effects are sedation, dystonic reactions, anxiety reactions, gynecomastia, impotence, diarrhea, but we should watch for extrapyramidal side effects because these drugs act via blockade of dopamine D2 receptors. Another last category here is the neurokinin 1 receptor antagonists, which is mainly apriptant. It is a highly selective neurokinin 1 receptor antagonist. It has no affinity for serotonin, dopamine, or corticosteroid receptors, so it is a highly selective NK1 receptor antagonist. For apriptant is an IV formulation which can be converted to apriptant within 30 minutes after infusion. Looking at the pharmacokinetics, the oral bioavailability is about 65%. It can cross the blood-brain barrier. The serum half-life is about 12 hours, metabolized by CYP3A4 pathway in the liver. It is excreted into urine. The clinical uses: chemotherapy-induced nausea and vomiting. It can be used in combination with 5-HT3 receptor antagonists and corticosteroids. The main adverse effects, there is fatigue, dizziness, and diarrhea. For the drug interactions, apriptant, it inhibits the metabolism of docetaxel, that is a chemotherapeutic drug, paclitaxel, etoposide, and others, and hence it increases their level and toxicity. Thanks for listening. Don't forget to subscribe.